हेयर ट्रांसप्लांट कोई करता है तो हमको दिखता है दैट ट्रांसप्लांट इज डन, नेचुरल नहीं दिख रहा है, बट ये सब चीज़ आपकी हेयरलाइन पे बहुत ज़्यादा डिपेंड करती है. पेशेंट्स कई बार आते हैं, हमको किसी फोटोज़ कोई सेलिब्रिटीज़ के दिखाते कि मुझे ऐसी हेयरलाइन चाहिए. यू कैन नॉट डू दैट बिकॉज ऑब्वियसली हिज एज, हिज फेशियल स्ट्रक्चर इज नॉट वॉट यू हैव. In our technique, we are not making any cuts or stitches. There is no question of any scarring here, and whatever clots are also seen, वो 10 days में निकल जाते हैं.
Hello everyone, welcome back to the new episode where we are going to discuss what technique we follow in Look Studio for the hair transplant. So in Look Studio we do bio-integrated FUE with implanters. Now in this technique there are 4 steps are involved. First is the hairline design, second is the extraction, and third implantation, fourth is the result. Now these 4 steps Dr. Monish will discuss in detail how these 4 steps are carried out.
Yeah, so as you said, these 4 steps are very crucial so that we achieve a good result for the patient. So the first thing, the hairline.
Yeah.
For me, I think this is the most important part of hair transplant, which starts well before the procedure.
Yes.
You would have heard a lot of patients saying that हेयर ट्रांसप्लांट कोई करता है तो हमको दिखता है दैट ट्रांसप्लांट इज डन, नेचुरल नहीं दिख रहा है, बट ये सब चीज़ आपकी हेयरलाइन पे बहुत ज़्यादा डिपेंड करती है.
करेक्ट.
सो बिफोर यू डिज़ाइन अ हेयरलाइन देयर आर सर्टेन फैक्टर्स विच यू हैव टू कंसिडर.
करेक्ट.
अब उसमें सबसे इंपॉर्टेंट होता है एज, एट वॉट स्टेज दैट पेशेंट इज अंडरगोइंग ट्रांसप्लांट. सो फॉर एग्जाम्पल, इफ अ पेशेंट हु इज कम टू मी एट 38 or early 40s, so I cannot design a hairline when he was or how a patient at 24 or 25 would be. So the age is very crucial. Then comes your facial structure. So
Right.
no two people have the same face. तो hairline भी same नहीं हो सकती. हाँ, अब patients कई बार आते हैं, हमको किसी photos कोई celebrities के दिखाते कि मुझे ऐसी hairline चाहिए, but you cannot do that because obviously his age, his facial structure is not what you have.
Correct.
So these 2 factors are very important when you're going to design a hairline.
Right. I just want to explain the viewers by facial structure what he meant. Everybody doesn't have a same facial structure, right? So some people might have a forehead of this length, some people might have a forehead of this length. If somebody's forehead is little taller, okay, then the hairline has to be made from that point. All right. So if the people, those have small forehead, the hairline can start from that point. So it will change from face to face. So hairline design is really, really important. So the second step is extraction process. So doctor, can we continue with the extraction, how the extraction is carried out, what things a surgeon or they should consider while doing extraction to make sure the survival of the root, because the root is getting transferred from the back to the top, right? So in this time, in this process, the root shouldn't be damaged. That's the important factor which plays into the result aspect. So what all things doctor has to take care while extracting the roots? Can you please explain that?
Yeah. So before we start with the extraction, an important factor here is the local anesthesia. So when you're going to plan your donor, you have planned your donor from which specific area you're going to extract, because that is also a very important part of extraction. You need to know which is the perfect donor, whether that area that you are going to use that donor, whether it lies in the permanent zone or it doesn't. So once your donor is set, then you start with the local anesthesia.
Okay. Local anesthesia for the pain.
So that there is no pain during the procedure. Now extraction in bio-integrated FUE, there are certain factors which differs and which makes us slightly better than conventional FUE. First, the way we extract, so it is not manual. We have rotomotorized devices that are used. Yeah, they are surgeon operated devices, but that makes the entire process much faster, easy हो जाता है patients के लिए, because it is obviously motorized machines that is removing those grafts. The control, the effectiveness of the technique is much better because सब कुछ program रहता है, what size punch you're going to use, how deep, what speed you're going to use, so that the percentage of graft being damaged during the extraction is pretty less. जब आपने extract कर लिया, now how you going to store
pretty
that?
less मतलब averagely कितना graft transact हो सकता है?
Not more than 3 or 4% will go, which at this stage is considered like next to 100% result.
Right.
I will definitely not say that all 100% graft is going to be extracted, but 95 to 96% of extraction graft survival rate post extraction is what we see. Then once you have extracted those grafts, अब उसको जो store करना, because immediately you're not going to implant, so it is stored in a particular solution which is going to keep the grafts viable for a long time. We control the temperature as well. So you know, graft is a part of your body. You want to remove it, so that temperature ideally, 3 to 4 degrees Celsius is what we need to keep the grafts in. It's a living tissue at the end of the day.
Right.
So we need to take care of that. So we control the temperature, the solution, everything. And once all the grafts have been extracted, they are segregated.
Yes,
so we are not going to mix those grafts, as you know.
Segregation means?
So single hair grafts are going to be kept different. 2 hair graft are different. 3 hair graft are different. 4 hair graft are different.
And why we do that?
All the single hair grafts are going to be implanted in the front 2 rows of your hairline.
Okay.
So that is how you get an illusion that it is something which is coming out very naturally. You cannot start giving density with 3 and 4.
Like a transition.
Exactly.
From skin to hair. If you're going, there should be a transition with the texture of skin through the hair coming out, so that you can see it like a natural creation.
Yeah. So all the single rooted hair are used in the hairline most probably. 3 and 4 hair are used majorly for the top and the crown area, where you need to give an illusion of a high density with limited grafts. So in that case, most of the 3 and 4 hair grafts are used there. So that is where the segregation here is also important. And very important thing is the handling of the grafts here is very minimum. So as soon as it is out, it is stored. So you are not going to physically handle the grafts, so that
traumatization बहुत कम हो
exactly
जाता है,
traumatization कम है, तो जहाँ traumatization कम है वहाँ graft survival automatically बढ़ जाएगा. So this is the extraction part. Next comes the crucial part, is the implant. So we have spoken about the slit technique and why we are slightly skeptical with that. So in Look Studio, we use implanters to implant. Now what implanter is? So implanter is a device where the graft is loaded in the particular slot of the implanter, and it is implanted directly into the recipient side.
You so just no holes are created.
There is no pre-homed holes. आपको कोई hole बनाने की जरूरत नहीं है. The implanter will take the graft along with it. So the 2 most important points, your direction एंड योर डेंसिटी, वो पूरे आपके कंट्रोल में रहता है. आप जितना चाहिए उसको क्लोज डेंस कर सकते हो, बिकॉज यू आर गोइंग टू एट द एंड ऑफ द डे यू आर नॉट मेकिंग होल्स प्रायर, यू आर गोइंग टू इम्प्लांट इट डायरेक्टली. डायरेक्शन जो बहुत इंपॉर्टेंट होता है, सो द डायरेक्शन ऑफ द हेयर जो आपकी हेयरलाइन या फ्रंट एरिया में होगा, इट इज नॉट सेम एट द टॉप एट द क्राउन. स्पेशली व्हेन यू आर इम्प्लांटिंग द क्राउन, यू विल बी सरप्राइज्ड टू नो दैट एवरी हेयर माइट हैव अ डिफरेंट डायरेक्शन. सो द फ्रंट पार्ट ऑफ द क्राउन का डायरेक्शन अलग होता है, मिडिल का अलग होता है. डायरेक्शन इज इंपॉर्टेंट, एंड इवन the size of the graft and the size of the hole should always match in a slit technique, which is difficult to achieve. So with implanters, the size, the graft will go inside, वो उतनी ही जगह लेगा जितनी उसको चाहिए अंदर. So there is no question of different size. And very important, the direction part, because यही सब चीजें हैं जो आपका ट्रांसप्लांट को नेचुरल दिखाएंगी. So this is how implantation also, it is not randomly done. There is something known as a brick pattern we follow. So brick pattern मतलब ये है कि for example in a very simple language, अगर हमने 4 ग्राफ लगा दिए in a line, so the next 4 grafts are going to be implanted in between these. So इससे क्या हो रहा है, when you are going to look from a distance, you're going to see that the hair have merged well. It gives an illusion of a good density. So we call it something known as a brick pattern.
But
of
these
implant.
are two parallel lines.
Exactly. And again,
lines.
with limited grafts, you can give a good density with that technique. So this is how implantation is done. And then comes your results. So by result, here we mean is at the end of 7-8 months when patient comes to us, okay, this is how the result is. And if we feel that for some reason, no matter what it is, under our hands, patient's hands, the desired results are not what he expected, so we are going to reinforce that. We are going to put extra grafts from our side. So आप उसको वारंटी बोल दीजिए, but I usually tell it to my patients as आपका ट्रीटमेंट जर्नी वहाँ खत्म नहीं हुआ है जहाँ आपका प्रोसीजर हो गया. It ends after 8 months when you tell me कि yes, I am satisfied with the results. So even if for example we need to implant 50-100 grafts more in a particular area, we do it complimentary for our patients. And after the transplant, another part that we reinforce is PRP. So we have spoken about PRP.
So व्यूअर्स के लिए एक चीज़ आप क्लियर करो कि अगर 100% एक सैम्पल साइज हम लेके चलते हैं और 100 लोगों का ट्रांसप्लांट हुआ है, सो हाउ मेनी परसेंटेज ऑफ पीपल विल require that refilling session which you mentioned, that if required, post 7-8 months we do a touch up of extra grafts to improve the result. So how many percentage of people do require that session, and how many percentage people do not require that session, means they get a proper 100% result what they desire, right?
Yeah, so I can actually very clearly say that up to 85 to 90% of patients don't require any kind of touch-up post the results are out. It's only like 8 to 10% of the patient. At times it even happens that patient might be happy with what he has achieved, but we feel, if we could have done something better, it will look much more better.
Yeah.
So those 10%, 8 to 10% patients where we do pitch in those extra graphs to make the results look very good from our perspective.
Yeah, got it. So we have seen such cases where people have done the transplant in the past and they have lost those hair post, after getting the result after a couple of years. So basically those people were not eligible for transplant, that's why they have lost their hairs, right? So those cases, that's what, people should consult to understand whether they are right candidate for transplant or not. This donor is really important. If this is permanent for the life for you, then only you can go for the transplant. If you are into diffuse male pattern baldness where you lose back of the head hair also, then you shouldn't be proceeding for a transplant. So the doctor also has to be selective while doing the procedures, and that's what we do in Look
You know it better. You know how many patients we usually reject every month.
Yeah.
So we are not here to do every patient. So as you said, diffuse alopecia, there are patients
you have two hands. You can do one patient at a time.
Exactly.
And even 100 comes, doesn't matter.
Doesn't matter.
You have to do one by one, right?
The patient selection is very important here. If you are going to select it the right way, the case planning is right, nothing can go wrong. Trust me that.
Right.
But that is why not every patient, as we have discussed prior, there are certain things that you consider before you plan a hair transplant. So in such situations like diffuse alopecia or extreme grade 7 where donor is itself very less, as you say always, there should be a balance between what is available and what is needed. So if that balance is not right, it's better to avoid such cases.
So doctor, explain us the precaution a patient has to take before the procedure and post procedure, plus the result phase, how the result is going to come post the procedure.
Sure. So now when we talk about before the procedure, so the most important part here is there are certain pre-procedure investigations that are needed from the patient side. So not just for transplant, for any medical procedure, there are certain investigations, some blood tests that are needed. So ideally that is performed within a week prior to your transplants. Once the reports are there, for patients who have habits like alcohol or smoking, they are instructed to stop it 2 days before the procedure, and for the next 8 to 10 days they have to avoid that. So these two are the only important things before the procedure. So now once the procedure is done, transplant is done, the important part here is how you're going to take care of the implanted area. See, the donor will heal itself. You don't need to take extra care for the donor, but the area where you have implanted. So patients, lot of time they ask us that I cannot go out, I have to 10 days, I have to sit at home, because for 10 days the clots are visible of your implantation. So when you implant, there is a small oozing spot that comes and वो clot बन जाता है, and those clots are needed because वो आपके grafts को 10 दिन तक hold करके रखता है. So ऐसा नहीं कि वो 10 दिन आपको घर पे बैठना. You don't have to stay back at home for 10 days. In fact, patients resume their day-to-day work after 1 or 2 days after transplant. Only care is they need to cover it, so they can wear a loose cap or a hat or even a normal bandana is fine. Extra care is taken. So in terms of physical activities, patients who go to gym and running exercise, that has to be avoided for 10 days. And you can start with application of water on the implanted area for the next day, because patients again say कि हम 10 days now we cannot take bath. So ऐसा नहीं, you can apply water, you cannot shampoo, you cannot oil your hair for those 10 days, but you can definitely apply water or saline from next day. So extra care here is only in terms of extra physical activities that needs to be avoided.
A little restriction in the activity for 10 days.
Exactly. Okay. You can travel, you can go back. No, patients are even, you will be amazed to know that patients come, get their procedure done, and next day they fly back home. So ऐसा नहीं है, there is no restrictions in that. But ये 2-3 चीजें हैं, extra activities, physical activities, जिसको आपको avoid करना है, lifting heavy weights or patients who have an habit of regular application of oil and any products has to be avoided for 10 days. Okay. So the growth or the results when you see after 10 days, when those clots are removed, you get your first shampoo after 10 days, आप करते हो, you will see the growth in on that 10th day itself.
Okay.
You will see that hairs have grown and they will actually match your rest of the hair. It will just look like आपने बाल छोटे रखे, हेयर कट लिया हुआ है, करेक्ट.
ठीक है, क्रू कट जैसा लुक आएगा.
Exactly. And
any
after
scarring, any wounds, anything?
Scarring and all is not possible with this technique. In fact, the donor wounds within 6-7 days वो पूरा heal हो जाता है, because as you know in our technique we are not making any cuts or stitches. There is no question of any scarring here, and whatever clots are also seen वो 10 days में निकल जाते हैं. After 10 days
इसके बाद रिजल्ट ग्रोथ आगे कैसे कंटिन्यू
हाँ, so for the next 1 month वो continuous growth होता है. The newly transplanted hair 1 महीने तक बढ़ते हैं. Then there is something known as a shedding phase. So बाल की हेयर की साइकिल होती है. There is a growth phase, there is a falling phase, there is a resting phase. So once you have transplanted, ये जो जितने भी हेयर जो ट्रांसप्लांट हुए हैं, दे गो काइंड ऑफ समथिंग नोन एज अ रेस्टिंग फेज, कि वो उनका ग्रोथ कुछ टाइम के लिए बंद हो जाता है. हम उसको शेड भी, वो टूटते भी हैं, दे इवन फॉल ऑफ. सो नेक्स्ट हाँ, ओनली ट्रांसप्लांटेड हेयर. सो नेक्स्ट 2-3 महीना यू विल नॉट अप्रिशिएट ग्रोथ. सो लॉट ऑफ टाइम पेशेंट्स डू कम के सर ट्रांसप्लांट हुआ है, दिख नहीं रहा, बट वी ऑलवेज हैव टू टेल देम बिफोर हैंड कि वो शेडिंग फेज होगा. सो 3-4 मंथ्स आपको रिजल्ट की फिक्र ही नहीं करनी है, एंड दैट इज नेचुरल. एक बार 3.5 months हो गए, then the actual growth of the new transplanted hair will begin. And after 4 months आप every 15 days in fact आपको वो better से better लगने लगेंगे. So we are let's say somewhere around 7-8 months 9 months तक at the max जो ट्रांसप्लांट एरिया आपके हेयर हुआ वो अपनी मैक्सिमम रिजल्ट डेंसिटी पे पहुंच जाते हैं. एंड इनफैक्ट ऑल द प्रिकॉशन जो मैंने बताए थे, 1 month बाद तो आप नॉर्मल हेयर कट, नॉर्मल हेयर स्टाइलिंग, स्विमिंग, एक्सरसाइज सब आप कर सकते हैं. इनफैक्ट माइल्ड एक्सरसाइज कैन इवन बी स्टार्टेड आफ्टर 12 days ऑल्सो. सो देयर आर नो प्रिकॉशंस आफ्टर 1 month मेजरली.
So we can conclude this video with the explaining you or highlighting you the differences of biointegrated FUE, what we do in Look Studio, and what we have explained earlier to you. In biointegrated FUE, what we do, we create a specific hairline suited to your facial anatomy, and then we extract the graft from the back of the head. We segregate them, and only single unit grafts are implanted in the front hairline to give you natural look. These segregated grafts are kept in a cooling environment, controlled temperature, to make the graft survive for a longer period, right, to reduce the traumatization and to provide the stable environment to the root. And post that, we implant with the implanters. We do not create any sort of slits, and the implanted roots are implanted in like brick patterns to create an illusion of more hair even with the less number of grafts available on the head. And after that, we give you warranty for the results, and that's how the biointegrated FUE is different than what we see traditional transplants. आपके जो भी questions हैं आप हमें लिख सकते हो comments में. We will reply you as early as possible. आपको कोई भी हेयर फॉल कंसर्न है, आप ट्रांसप्लांट के लिए देख रहे हो, कुछ क्वेश्चंस हैं, कंसर्न्स हैं, आप हमारे क्लिनिक्स विजिट कर सकते हो अपनी सिटीज़ में. आपको वेबसाइट पे जाना है, बुक एन अपॉइंटमेंट बुक करना है, एंड आपको विजिट करना है. हमारे डॉक्टर्स आपको हेल्प करेंगे to understand your cause of hair fall and to help you with the treatment. We'll be back very soon with the new video. Till then, stay tuned. Thank you.